Hello and welcome to News Across Nigeria. I'm Olumide Macaulay. On the program today, Nigeria joins the rest of the world to mark World Polio Day as state governments intensify awareness on importance of immunization. The military commits to resettling the Northeast, opens operational base in Buratai Town, Benue State. And the federal government restates need to maximize agricultural potential and reduce importation in Nigeria. Thank you so much for joining us. We begin in the north-central region of the country. The president is holding a meeting with the progressive governors of the APC at the presidential villa. Details of the meeting have not been made known to journalists as at the time of this report, but speculations have it that the governors may have been piqued by some of the actions of President Muhammadu Buhari, which may not have been favorable to the APC governors. One of such decisions is the ambassadorial list, which many say has not favored the governors' choices. The governors were seen strolling into the presidential villa at about 11:45 in the morning for the meeting scheduled to kick off at noon. The governors present include the chairman of the Governors Forum, Abdulaziz Yari of Zamfara State, the chairman of the Progressive Congress, Progressive Governors, Chief Rochas Okorocha of Imo State, the governor of Ogun State, Bukle Amosu, the governor of Edo State, Adams Oshomole, the governors of Kano, Borno, Kogi, and Benue, as well as the governor of Kaduna State, Malam Nasir El Rufai. Those who are not present have their deputies to represent them. Across Nigeria, the country joins the rest of the world to commemorate World Polio Day, a day to mark the birth of Jonas Salk, who led the first team to develop a vaccine against polio, highly infectious viral disease which mainly affects young children. The virus is transmitted by person-to-person spread, mainly through fecal-oral route or, less frequently, by a common vehicle, that is contaminated water or food. It multiplies in the intestine, from where it can invade the nervous system and can cause paralysis. Use of this inactivated poliovirus vaccine and subsequent widespread use of the oral poliovirus developed by Albert Sabin led to the establishment of the Global Polio Eradication Initiative in 1988. As of 2013, the GPEI had reduced polio worldwide by 99%. Groups in Benue State took to the streets to raise awareness on the need for immunization.
Recording 3 cases in any part of the country is equal to us having a case everywhere in Nigeria. So this campaign we are doing is to alert the public so that they can accept the only prevention we have. With the immunization, adequate immunization against polio, we can achieve 100% prevention of the disease. So we have not recorded any case, any reappearance of any case in Benue State. We've had reports that the Hausa community were skeptical about the polio immunization. And during the national flag off, we got the report that they were even rejecting the workers, the immunizers, and some were locking doors against them. So we decided the Rotary Club has enabled us to penetrate into the Hausa community. So the awareness is very key to allay the fears that it's a way of family control. It's not family planning event. This is to prevent polio. They have polio victims amidst them. They are all on the wheelchair there. So that disease is terrible. So it's good they see themselves, and it's not even injection that children should be running away. It's just dropping a drop in their mouth. And that one, if we keep on doing it, recurrence of polio will not be found in Benue and Nigeria as a whole.
Also in the health sector, the federal government has established 3 hospitals to cater for girls and women affected with obstetric fistula in Nigeria. Speaking at the International Obstetric Fistula Working Group meeting in Abuja, the Minister of Health, Professor Isaac Adewale, explained that 2 more will be established next year. The 3 hospitals are situated in Ebonyi, Katsina, and Bauchi states. Professor Adewale explained that education and poverty are root causes of the disease. Meanwhile, residents in Egbe in Yagba West local government area of Kogi State are calling on government for infrastructural development of the community. The coming of Christianity to the community in 1908 brought education and health facilities which were neglected over the years. In this report, our correspondent Gloria Umezuoke went to the ancient town and reports the state of infrastructure and efforts by missionaries to resuscitate the health facility.
Egbe, a border town between Kogi and Kwara State, a town known for its rich culture as well as a rich history of sound medical health care. Just like many other communities, residents here face a number of challenges, including inadequate electricity, road and water. Many go about their businesses with hope that the basic social amenities will one day come to the community. Those who complain about these lack of basic amenities testify that in this community there was a well-equipped hospital founded by missionaries in 1952. We drove through the town to the popular Egbe Hospital, currently being rehabilitated. Volunteer workers arrived the country to give a boost to the resuscitation of the hospital. Those living in Egbe and surrounding villages are aware of the repairs. One of the elders, Mr. Samuel Jegede, went down memory lane.
They started teaching people on how to take care of themselves, preventive measures, and immunization, and introduce health education in the school curriculum.
People embrace it.
63-year-old retired teacher Musumola Aino explains that the hospital has restored medical hope to the people, but the government needs to assist.
The best thing is that the government can come to their aid so that maybe in paying for the drugs, though the whites, they've really tried a lot, but they still need help so that an ordinary person will be able to go there and be helped.
The project's leader, Mr. Don Campion, who was born in this ancient town in Yagba West, underlines that more facilities in the 60-year-old hospital will be brought in.
In putting our initial plan together, it was let's get that infrastructure up and running so that staff can be comfortable and in fact the hospital can be back in place.
We've had many people come up and create a benevolent fund which does help provide health care for people that cannot by any means pay any type of a bill for their health or for the health of their children.
The revitalization of the Egbe Hospital is aiding healthcare service in 10 other communities, including Odoire, Isonlu, and even Ijiba. So all that's left right now is for the government to properly intervene to bring real development to the people. From Egbe in Kogi State, Gloria Umezuoke, Channels Television News.
Away from health to the commemoration of notable dates. The General Assembly in 1972 through Resolution 3038 instituted the World Development Information Day to draw the attention of world public opinion to development problems and the need to strengthen international cooperation to solve them. This is in recognition of the fact that information and communication technology have the potential to provide new solutions to development challenges, particularly in the context of globalization, and can foster economic growth, competitiveness, access to information and knowledge, poverty eradication, and social inclusion. The Assembly also recognizes that improving the dissemination of information and the mobilization of public opinion, particularly amongst young people, will lead to greater awareness of the problems of development, thus promoting efforts in the sphere of international cooperation for development. You're watching news across Nigeria. Stay with us. Coming up, the military commissions an operational base in Borno State.